I saw a patient once in her 60s who'd been taking 2 Advil twice a day since she was a child. On top of that, she used an admixture of barbiturate drugs, opiate narcotics, and daily caffeine as coffee. Her diagnosis was migraine without aura and medication overuse headache. She did better with education and limiting headache medication use, taking a triptan at onset for her migraine with good treatment effect. I live in a large metropolitan city, and she told me that she'd seen over 10 doctors for her headaches, and no one had ever discussed drug limitation to 2 days a week or tried a triptan. So that's another subject. The limit of acute headache medicine that should be taken by a patient with migraine is only 2 days a week. Headache doctors counsel their migraine patients that they must limit the use of acute therapy drugs to no more than 2 days per week. Why is this? During a migraine, the trigeminal nerve supplying the face and the eye is innervated, and 3 chemicals are released into the brain: substance P, neurokinin, and CGRP. These drugs inflame the cranial arteries and the trigeminal nerve in ways that are not completely understood. But the continued use of painkillers, triptans, opiate narcotics, and barbiturate headache drugs keeps this outflowing of the inflammatory chemicals occurring. The ganglia, the arteries, the nerve, and the brain stem release substance P, neurokinin, and CGRP. As long as the patient keeps over-treating with Advil, Tylenol, Fiorinol, or sumatriptan, these neurochemicals are released, and the headache continues. It was not unusual in a headache practice for me to see persons who had experienced daily headaches mixed with frequent times of severe headache for 20 to 30 years. Now, the problem with advising headache patients to stop their caffeine is they don't want to do it. They'll whine and beg and negotiate in the office and then cheat at home. They'll say, "Oh, I don't mind stopping my Fiorinol, my Tylenol number 3. No problem. But my morning coffee? I would die." But if they're able to take the advice, they'll do better. The recidivism rate, which means the fallback rate for patients with medication-induced headache, varies according to whom you reference. Google Chrome reports, according to a guideline published in Neurological Research and Practice, the success rate of therapy for medication-induced headache is about 50 to 70% after 12 months. That means 60-70% of patients are better. However, there's a huge relapse rate, especially in patients who were taking opiate narcotics. I've never seen a published rate for success with stopping caffeine alone. I think it would be lower. But that's the beauty of the neurological article I'm citing in this blog, which reports on the relationship between caffeine intake and severe headache or migraine. So what is this article? I'm going to report it here. You can look it up on the internet. The reference article for what I'm talking about today is by Zhang and Yin, Y-I-N. It's in Scientific Reports 2023. If you just plug that into the internet, you'll find it. And the title is Association Between Dietary Caffeine Intake and Severe Headache or Migraine in U.S. Adults. What's the abstract? The authors think the relationship between current dietary caffeine intake and severe headache or migraine is controversial. Therefore, we investigated the association between dietary caffeine intake and severe headaches or migraines among American adults. This cross-section study included 8,993 adults aged over 20 years old with a dietary caffeine intake from the National Health and Nutrition Examination Surveys of America from 1999 to 2004. I'm going to quote for parts of this article. In the United States, adults, after adjusting for potential co-founders, a 100 milligram day increase in dietary caffeine intake was associated with a 5% increase in the prevalence of severe headache or migraine. Further, the prevalence of severe headache or migraine was 42% higher with caffeine intake of over 400 milligrams a day than with caffeine intake of 0 to 40 or less. Conclusively, dietary caffeine intake is positively associated with severe headaches or migraines in U.S. adults. Now, another problem here is the American Headache Society recommends over-the-counter drugs like non-steroidal inflammatory drugs like NSAIDs, acetaminophen, aspirin, caffeine, ibuprofen as level A, or the first kind of drugs you should take, recommendation for reducing migraine and other symptoms. But if you take too much of it, it'll cause problems, as we discussed. So this is basically the conclusion of this article. Hope it's been helpful to you, all you folks who are thinking about getting off their caffeine to help with their migraine. God bless you. Hope you do well. Please click like and subscribe down there, and I'll see you again on the next talk.